The primary focuses are lifestyle. So behaviors that are going to increase healthy eating, active living, and obesity is really kind of a secondary measure, as well as other chronic diseases that we're trying to prevent, such as heart disease, cancers, diabetes, and so forth. But obviously, obesity is the most prevalent chronic illness. And what we're doing is we're trying to create a multi-level, multi-sector prevention program. And really all of the community programs thus far are really have been focused on obesity. So obviously a lot of the material is focused on that disease process. So I think it's good to, with this overview, I think it's good to have a good understanding of what having unhealthy weight is all about, what it is, how it comes about, and we're going to go through a lot of the data. A lot of it comes from the very nice work that Patricia did with the state obesity report for 2022. So this is what I'd like to cover: what obesity is, a little bit about what causes it, and then obviously impact and where we are now with the current state of prevalence of this disease process. This is for children, and on the left for girls, and on the right boys, and it's based on age, which is on the bottom axis. Green is considered healthy weight, blue is considered underweight, yellow zone is overweight, and then the red is where you get into the body mass index that signifies obesity. So this is what I look at on a daily basis with my patients to determine what their weight status is. And this is kind of an oversimplification but important group of photographs that help explain how we got to where we are over the last 40 or 50 years regarding our lifestyle and, community infrastructure. But it's a lot more complicated than this. Important behaviors that we track with the Nevada High School Youth Risk Behavioral Survey comprise a lot of those behaviors and a lot of what we're trying to alter with 5210. But what's important here with this most recent data is BMI has been increasing steadily over the last decade, and it really took a nice jump through the pandemic, as you might imagine. This is a diagrammatic of all the organ systems that can be affected by childhood obesity. And really, it's the same for adults. I put this up here. This is an 11-year-old patient, actually a patient of mine that I used to follow at Community Health Alliance. And I put this up here just to show you how devastating this illness can be to a child, particularly a prepubescent child. And I always tell people that if you didn't know what the age of this person was, and I asked you, to guess, you'd probably say this person was, 40, 50, 60 years old. But this was an 11-year-old who had a number of complications from having extra weight. So a sad state of affairs, and there's a lot of kids like this. So this is a quote out of the Weighing Down America Report 2020 from the Milken Institute. And the Milken Institute is affiliated with the George Washington University School of Public Health, which does a lot of work with obesity. And the Weighing Down America Report is a national report showing the impact of obesity across the entire nation. And it really focuses on social determinants of health. It's really a pretty extensive and very interesting report. So if you ever have time to look at it, I would encourage it. But a quote out of this report kind of sums it all up. And that is, obesity is a complex issue. Our results confirm that solutions will require complementary actions from federal and local authorities, as well as leaders in the public and private sectors such as healthcare, business, education, childcare, and the community. So basically, what we're trying to do with 5210 is to follow the recommendation of this from this organization. And there's a number of other organizations that echo the same recommendation. So I'm going to take you through quickly the Healthy Community Study, which is really a pretty cool study that just came out, was published 5 years ago. And it was a 10-year study looking at 130 communities across the country with thousands of children, grades kindergarten through 8th grade, from 400 plus schools, and almost 10,000 community-based programs and policies were evaluated. In the methodology for this study, a policy and program intensity score was created where, depending on a program or a policy, how much, what type of strategy it had, how deep the reach was into the community, and the duration of the policy of the program determine how high that intensity score was. What was typically seen was this intensity increased over time with these policies and programs, and that the intensity was related to lower body mass index in children. But there was some variation based on some variables, including grade, socioeconomic status, as we saw with the Nevada data for adults, setting, so urban versus suburban, as we mentioned earlier about rural areas having higher rates of obesity across the country. Then obviously ethnicity and race is a big thing. And what was disappointing in this study was most of the benefit was seen in white children and not children of color. So one of the conclusions in the discussion by the authors of this study was that we need to be very mindful and cautious with the programming and policy to make sure that we're making equal impact across all ethnicities and races when implementing community-based programs. So this was a community-based study. It was a 2-year model, 2003 to 2005. Somerville was the intervention city with this program, and then there were two similar neighboring control cities that were outside the sphere of influence of Somerville, so there wouldn't be any spillover from this programming. And they looked at grades 1, 2, and 3. So a lot of this was, heavily based with school programming, and the focus was on increasing physical activity and increasing consumption of healthy foods, particularly fruits and vegetables. And you could see pre-pandemic, the data for Maine was pretty stable, pretty flat, which is nice to see. And you may not remember, but if you do, the national data showed more of an upward trajectory during the same time period. So I think what's interesting is during the pre-pandemic time period, obesity prevalence overall was lower in the state of Maine. Also, the stability seen in Maine was not being seen in nationally collected data. And then you can see the uptick starting in 2020, 2021, getting into the pandemic. 20.1% overall. For the US, it was 22.4%. So still staying below the national average. And then quickly dropping. So there's a nice correction in 2022, which is nice to see. So hopefully this shows that there's some resilience in this population, maybe due to the penetration of Let's Go and the 5210 messaging. It'll be interesting to see how this trends out over the next year or two. And I include this information too from Let's Go because it breaks it down into ages. And you can see pre-pandemic, what I mentioned before, you typically see obesity prevalence increasing with age. And this I haven't shared with you yet, but this is one of the resources. This is the scientific rationale. So that evidence base for each of the numbers and the behaviors that those numbers represent. So this is a nice flyer. It's good for providers. Obviously if a patient wants more information, this could be also used to give them, if someone is more technical or has a higher level of sophistication, they may want to see some data behind these numbers. And then we get into the Healthy Habits Questionnaire, which I have mentioned, but I haven't shared with you yet. But this was developed by Let's Go, and it not only assesses 5210 behaviors, but it also assesses some other behaviors like sleep, which we know is very, very important, and we need to talk about. Talks about, skipping meals. How often do you eat out? Again, we want them to focus on healthy behavior and not weight. Weight is important, but the behaviors are what we can control and are most important. And then we want to impart a team approach. It's just not the providers. It needs to be all staff promoting this healthy messaging and promoting healthy behaviors. I know places that I've worked, lots of times you'll end up with donuts and cupcakes and juice and other unhealthy things on counters or desk. You want to get to the point where the environment in these participating organizations are promoting, basically walking the talk. Obviously, you don't want a patient walking back to a room and seeing a dozen donuts sitting on someone's desk or, a bottle of soda. So the other environmental variables are important, like furniture and equipment that fit people of all sizes. We don't want people to feel uncomfortable if a blood pressure cuff doesn't fit, or they're too big to get on a scale, or fit in a chair in the waiting room. And then there's biases. We all have biases. We all have implicit biases, and that needs to be checked at the door. There are programs that healthcare providers can go through to identify implicit biases and to work on eliminating those biases, or at least minimizing them. So that's important as well. And then helping patients and families focus on one area at a time. Small changes. We want to use SMART goals, I know that the S in SMART is specific, but I think it could be used for small too. And again, our tagline is small changes, big results, as you can see in the lower right corner. So all of this is important kind of prep work that organizations that really want to implement this programming are going to cover before they fully implement. And I show this just because it does show that small steps are 5210 for adults, which will eventually roll into our program. I think it's nice when you can have both 5210 and small steps available, because one message may ring true to one person versus the other, so it gives them options. And then the talking about site champions and clinical champions, as we've already discussed. We'll talk about the annual survey and the importance of the annual survey, and then what's required for site of distinction recognition, and then going through the resources. Some of them are specific of our program, others are links to other information like the American Academy of Pediatric Clinical Practice Guideline, and some things that we don't have developed yet that you can access on the Let's Go website. This is a nice checklist for practices and clinics, or checklist for implementing. Obviously, identifying those champions is first and foremost, and then the questionnaire. The back of the questionnaire is nice because there's some nice options or tips that people can use to help them achieve the 5210 behaviors. Having a healthy attitude and healthy behaviors being promoted by all staff, and then having that healthy habits questionnaire given to patients as early as possible so they have time to look at it and complete it before they talk to their provider. And then they talk to the provider about this, and then that can actually turn into a prescription for a change. I will use it to write down goals for patients and to give them some resources. For instance, like an app they could use, or a website that could be useful to help them meet a goal. And they'll get that and they'll take that home with them.